everybody. I want to thank you so much for joining me on this presentation. It is going to be about Assembly Bill A1410. Now, Assembly Bill A1410 is a bill that was introduced in 2017 in New York State and is currently in Assembly. So it's currently in the works, in progress to maybe get approved. And its goal is to promote the development, provision, and accessibility of telehealth, telemedicine services in New York State to establish a telehealth, telemedicine development and research grant fund. So the main goal of this is to get a big fund of money together, create a committee so that research can be done in developing technologies for medicine and develop a network throughout the entirety of New York State so telemedicine services can start to be implemented eventually with providers and the other healthcare staff. Now, I support this bill for multiple reasons. I think it will help the rural community. It will help home care patients, decrease hospital readmissions, cut costs for both patient and staff, and then also support further technological advancements within the healthcare field and out of the healthcare field. So the rural community is a big part for me. In upstate New York, we have a very large rural community, and in the United States in general, according to the United States Census Bureau, about 20% of the population lives in a rural community. However, in the rural community, there's a higher percentage of uninsured individuals, there's a lower median household income, longer wait time in all rural emergency services, and just in general, higher mortality rate. So it's definitely a population that needs better care. So hopefully with the advancement of telehealth services, that care gap can kind of be closed. So with telemedicine services, patients can log in from their computer or whatever device that they have and speak to a provider if they need to, or get triaged if they need to and get the care they need to from their home. So they don't always have to drive an hour to get to a hospital or maybe 5 hours to see a specialist, which unfortunately is what happens in a lot of these communities. I also think it will help home care patients. With home care patients, they are either older individuals or just individuals with a lot of chronic healthcare problems, so they can't leave their home very easily. A lot of facilities do have it set up where nurses, providers, aides will go into the patient's home and help them, but it's very hard to get 24/7 care for these people. And telemedicine can kind of help reduce the strain on caregivers and help the patients manage their chronic care conditions. So if they have questions about their medications, how they should be administered, or how they should work on their G-tube, they can get into contact with a provider or a nurse easier that way. And it won't replace the action of a real in-person provider or healthcare professional, but it can help bridge that gap. Hospital readmissions is a big focus on a lot of hospitals, mainly because a little while back, Medicare came out with their hospital readmission reimbursement program, so they are not reimbursing hospitals as much money if there is a certain number of readmissions within the 30-day mark for patients. It was in 2019, there was a study done that found about 16% of adults 65 years or older on Medicare were readmitted to the hospital within 30 days of discharge. That's a lot of money that the hospital is going to lose because the hospital is not getting reimbursed as much money from Medicare. So I think that telemedicine will help reduce the amount of hospital readmissions. It can help manage the medications once discharged, because we all know that once a patient's discharged, their medications are going to change. They're going to get new medications, they're not going to know what to do with it. So we can help them understand it better. We can help clear up any follow-up instructions after discharged. And in general, it can possibly lead to it can lead to 18% less hospitalizations. It can also help cut costs. I found a study that showed that telemedicine may save about $20,000 annually per medical facility. Now that is a very rough estimate, and I think that as the years go on and more technology is created within telemedicine, the number will go up quite a bit. This is just what they're saying now. It can help decrease operational costs of facilities and the premium for telemedicine services is going to be lower than possibly walk-in or ER visits. I also think that it will help promote the advancements in technology. There's already studies being done to look at possible wearable wireless sensors that can monitor the heart rate, the blood pressure, glucose, whatever need to be monitored, and it's going to advance over time once more research can be done, but that will allow the person's chronic healthcare conditions to be monitored, and then doctors and healthcare providers can see what's happening with the patient. Do they just fall? Did their blood pressure just drop? They can see it from a distance, not have to be right there with them, so they can get the patient the help they need. Whenever you have a large amount of information being stored wirelessly, you need a good cloud storage. So cloud storage will need to make sure it's very secure for the telemedicine services, because medical data is very costly. There's a black market for it. So technology will have to be kind of improved so cloud storage can be secure for the patients, and then that can help other businesses and companies as well, because we all have social security numbers stored in the government, and then we have like bank information that all needs to be secured. So, and then I also think that having telemedicine develop more will help get better applications for phones or tablets. Right. And then I did some interviews for some healthcare professionals around the area. One provider thought that telemedicine can help the rural community access specialty care, but it will not replace face-to-face interactions with physicians. I do agree with that sentiment. I think that sometimes the provider and the nurse just need to be there with the patient. They need to do a physical exam and be there in person in order to get the full proper assessment. But that doesn't mean that there can't be specialty care or conferences done over the phone or over the tablet to help these patients. I had another healthcare professional say that telehealth will help the pediatric population reach specialists for their healthcare needs quicker and easier. This is a big issue with a lot of the pediatric population, because especially in the rural areas, there are not pediatric specialists within driving range for a lot of people. Sometimes you have to drive 2, 3, 4, 5 hours to just reach a pediatric endocrinologist. And that's not helping the child get the care they need. Maybe the parents have a hard time getting to that facility, and it's a child who's going to suffer. My references are here. I'd like to open up for any questions that people have. Any questions, comments?
I actually saw an ad for this on Facebook where you were just doing this.
Oh,
so
did
it's
you?
so weird that you have your presentation. Yeah, I was scrolling through Facebook and it popped up. I'm like, oh, that's new.
Yeah, we actually do have, I think it's his name's Sean. He's the head of telehealth and telemedicine development within UHS.
It's on the internet.
Mm-hmm.
Yeah, that's so cool.
Well, how are they getting vital signs? What about vital signs?
Well, we do already have machines that do the vital signs without us doing much for it. A lot of patients even have the little cuffs where they slide up their sleeve and they press a button and it measures it. So obviously a lot of this technology is not all the way there yet. So to have a complete telemedicine network is far down the line, I think, but it's something to work towards.
Mm-hmm.
And even though it's not here yet, we can start working on the technology for in the future when it'll be better. Yeah.
Absolutely.
So, is there a time frame that the governor of New York wants this implemented and actually running for the general populace?
The bill has to pass first.
Okay.
The bill's not passed. This is still in assembly, so I don't have an exact time frame. And even if they did come up with a time frame, I can't necessarily say that it will be done within that time frame because there's so much to work on and to develop.
Yeah, because a lot of those same rural areas that you're talking about don't get cell service or internet.
No
Or
internet
not
service,
high-speed
no.
internet.
And they maybe don't have phones, they don't have tablets with video,
Right.
and that's something that definitely needs to be worked on. But I mean, if we look at how 50 years from now computers were barely a thing, and how far they've come.
Very good point.
Yeah.
Mm-hmm.
I think I like it now that I've heard more about it. Because
Thank
we were
you.
talking with Dr. Young, and I don't know that this is something that he was all for at the moment, but because he wants them to come hear the patients. they are providing other services. And we have all these people that can't get to the doctors.
Yeah, you're totally right, and it doesn't have to replace the face-to-face interactions, it will just supplement it. So all the phone calls we get, people saying, oh, I have this going on, I think I'm having heart, I think I'm having a stroke, and sometimes they can't explain their symptoms very well. Maybe having a video chat would help. Or if they have the devices in the home to get those vital signs would help us triage them properly.
Do you think that's the future, to get these people tablets and stuff? You mean?
Yeah, it could be an option if some people can't get it on their own. It's futuristic, but I think that it can at least be started.
Oh, yeah, yeah.
Thank you.
Thank you.
Thank you.